Hello and welcome to the UNAIDS Asia-Pacific regional launch of the World AIDS Day 2024 report. We're so pleased that you could join us. On behalf of my team, thank you for coming. And we're here to discuss some of the regional challenges with respect to human rights. But we're not just going to talk about problems, we're also going to talk about solutions, and in particular, the untapped potential of U equals U. Undetectable equals untransmittable, to help address HIV-related stigma and discrimination in Asia and the Pacific, and therefore also the human rights situation that we face. What exactly does the World AIDS Day theme mean? Take the rights path. Well, to set us off, we're going to hear from our Goodwill Ambassador, Pia Alonso-Wurzbach.
We can end AIDS if we protect everyone's human rights. We've come a long way. We know the path to ending AIDS, but it's going to take more than testing and treatment. To get there, we need to respect people's rights. When health services aren't safe or friendly, when people are arrested instead of helped, when some are denied housing, education, or employment just because they're living with HIV, we're not just hurting them, we're also slowing ourselves down. That's why this World AIDS Day, we call on our leaders and our neighbors to protect everyone's human rights. We can end AIDS, but only if we take the rights path.
So that's our agenda today. How do we take the rights path together to end AIDS as a public health threat in Asia and the Pacific? Our Regional Director, Eamonn Murphy, is not here with us in person, but he did record a message to give a bit of an overview of this year's report themes and how they relate to our region.
Through activism and action, the HIV response has always found a way. Today, we can dare to imagine the end of AIDS as a public health threat as a reality for all. Globally, almost 31 million people living with HIV were accessing treatment last year. New HIV infections among children have reduced by 78% since 2000. And compared to 20 years ago, AIDS-related deaths have declined 70%. This is certainly due to scientific advances, but it is equally linked to the progress in protecting human rights. Without rights advocacy, people everywhere would not get life-saving drugs. The AIDS response broke the mold for global medicine access. This is in large part due to the demands of activists for universal treatment. Make no mistake, science without human rights would have resulted in treatment apartheid. Human rights advocacy and standards have shaped so many aspects of the modern HIV response, including the right to voluntary testing, the right to confidentiality, the reproductive rights of women living with HIV. Without these values and standards, the HIV response would be unrecognizable and entirely ineffective. But although we have the tools to end AIDS as a public health threat, too many people living with HIV and key populations are still being left behind. Some still feel fearful about getting an HIV test. Many worry about being scorned or reported by nurses and doctors and healthcare workers. And millions have lost hope because of how they were treated in their homes, on their jobs, in their communities. Every minute a person dies due to AIDS. To change this, we need more than testing and treatment. This new report by UNAIDS shows that the world can only end AIDS as a public health threat if leaders protect the human rights of everyone living with or at risk of HIV. And where there's impunity for gender-based violence, when people can be arrested for who they are, when a visit to health services could lead to arrest, the result is that people are blocked from life-saving HIV services. Through the 2021 Political Declaration on HIV and AIDS, United Nations member states committed to ensure that less than 10% of countries have punitive laws and policies. Less than 10% of people living with HIV and key populations experience stigma and discrimination. and less than 10% of women and girls in key populations experience gender inequality and violence. To protect everyone's health, we need to protect everyone's rights. HIV criminalization remains a challenge today. Laws that specifically target people living with HIV for engaging in conduct that is legal for others do not make anyone safer. They're a disincentive for people to learn their status and to access prevention or treatment, and they ignore the reality of living with HIV in the 21st century. Today's fair will explore the concept and the potential of U equals U, undetectable equals untransmittable. Public health is best served with laws, policies and practices that support people to be diagnosed early, to immediately start treatment and to achieve viral suppression. Yet in Asia and the Pacific, 16 countries still explicitly criminalize the transmission, the non-disclosure of, or the exposure to HIV, and 15 countries restrict the entry, stay and residence of people living with HIV. Today you'll also hear about the story of Shan from Pakistan. He was a migrant worker who was deported because of his HIV status. This is not only inhumane, it's unnecessary today. Travel restrictions and mandatory testing propagate stigma and discrimination while creating barriers to services and access for people living with HIV and people at higher risk of HIV. There is an urgent need to enact and implement laws and approaches that uphold the rights of people living with HIV. In 2022, almost half of new HIV infections in Asia-Pacific were among men who have sex with men, or MSM, with 43%. According to this year's Global AIDS Update, across the region, new infections have increased by 32% among men who have sex with men since 2010. The Global AIDS monitoring from 2020 to 2024 found that only a tiny 4% are able to access pre-exposure prophylaxis or PrEP. PrEP are HIV drugs that prevent people from contracting the virus if they're exposed and are crucial in the response to prevent new infections. The available data show us that stigma and discrimination remain major barriers for Asia-Pacific MSM. Many report avoiding healthcare due to prejudice. There's also an urgent imperative to support MSM to access prevention, testing and treatment services. But the criminalization of this community has the opposite effect. It reinforcing social prejudice and making men afraid or ashamed to access services and care. 17 countries in Asia-Pacific still criminalize same-sex relations. We know that gay men and other men who have sex with men living in countries with severe criminalization are almost 5 times as likely to be infected with HIV as those living in countries without such penalties. We have seen recent progress on this issue, both through parliaments such as in Singapore and the Cook Islands, and in the courts such as in India. In a region where the epidemic is either rising quickly or declining too slowly among MSM, we need to see more urgent action to create an enabling legal and policy environment for HIV prevention and treatment in this population. Transgender people are also more vulnerable to HIV. They are among the most stigmatized and criminalized, with the least access to services that address their needs. The median HIV prevention coverage for the trans community in Asia-Pacific was just 34%. That means 2/3 are not able to access the prevention, information and support they require. The rates of STI testing and PrEP are even lower for this community than for MSM. And the community reports shockingly high levels of stigma and discrimination, including many who have experienced physical or sexual violence in the last year. One impact of this stigma and discrimination is a relatively high proportion of transgender people who avoid healthcare, the necessary healthcare. This is highly marginalized population where we need more than legal and policy measures and community-led services to support their access to HIV services. There must also be collaborative efforts between governments and communities to address the social and cultural barriers that block transgender people from housing, from education and employment, not just access to health. With the exception of New Zealand, all countries in the region criminalise some aspect of sex work. Criminalisation does not stop sex work, it makes people go underground, putting them at higher risk of violence and HIV transmission. The report notes the current push in Thailand for decriminalisation, as well as the decriminalisation successes in the states of New South Wales, the Northern Territory and Victoria in Australia. In countries where sex work is heavily criminalised, sex workers are 7 times more likely to be living with HIV than those in countries where it's wholly or partially legalised. People who inject drugs have the lowest access to HIV prevention services of any key population at just 21%. Shockingly, under 10% of the region's opioid agonist therapy needs are being met. There are ineffective compulsory detention centres or similar systems for people who use drugs in 21 nations. These are ineffective. In 2012 and 2020, the United Nations agencies called for the permanent closure of compulsory facilities for people who use drugs, citing the lack of due process, forced labour, inadequate nutrition and denial or limited access to health care. The picture these data paint is that the drastically punitive legal environment actually constrains the provision of the essential harm reduction and life-saving services for people who use drugs. The report features an essay by Dr. Adiba Karamsul Zaman, who is the president of Monash University in Malaysia and the former president of the International AIDS Society. She writes that providing HIV prevention and treatment services to people who inject drugs, including people in prisons and other closed settings, led her to become deeply involved in the reform of drug policy in Malaysia and elsewhere in the region. It was clear that only by aligning drug policy with human rights principles would it be possible to advance public health for all. Since offering harm reduction services, needle sharing has stopped being the main channel for HIV transmission in Malaysia, and thousands of new infections have been prevented, showing the success of their efforts with harm reduction and their changes from punitive. The United Nations Office on Drugs and Crime, UNODC, and UNAIDS are together supporting countries to transition to evidence-informed and human rights-based services. We jointly recently launched the first ever chemsex toolkit for clinical service providers in Asia and the Pacific. Around 1/3 of new infections in Vietnam, half in Myanmar, Indonesia, the Philippines, Thailand, Cambodia and the Lao PDR are among young people in the age range of 15 to 24. There are rising new infections among young people in some countries, such as Papua New Guinea, Afghanistan and the Philippines. And HIV prevalence among young men who have sex with men has at least doubled in Indonesia, Malaysia and Vietnam. Fulfilling young people's right to health requires the provision of youth-friendly services. It also requires us to address the age of consent laws, access to testing laws, the healthcare worker attitudes that complicate the service access for young people and especially young key populations. Youth Lead, a regional leader, has recently developed a regional healthcare manual for healthcare workers and young key populations, bringing them together to pilot an approach to build the capacity of the existing health services to reach and retain the young clients. Today, the HIV response is at a crossroads. The Asia-Pacific region and the world need to tackle the prejudice and rights violations that are pushing the most marginalized people away from healthcare. Anti-rights policies generate fear amongst the communities who most need the HIV prevention, testing, treatment and care services, and also amongst the frontline community workers who provide these services. If urgent action is not taken, new HIV infections will be higher in 2030 than they are today, and more people will be living with HIV than ever before. Progress on human rights and the right to health will backslide. What governments do now will set the trajectory for whether we end AIDS as a public health threat and achieve a sustainable AIDS response, or whether we fail to achieve this and we pay a much higher price in terms of human life and the financial costs in the future. We can end AIDS, but only if we take the rights path and we walk it together. I close with a video explaining the links between laws, human rights and health.
Ang and Lee love each other, but their love is prohibited. They get beaten up, but they are too scared to make a police report. Kim is arrested for carrying condoms in her purse. Police detain and harass her. Pan sometimes uses drugs. He wants to go to the clinic for an HIV test, but he's worried that the nurses will report him. Laws play an important role in society. Criminal laws are a set of rules defining illegal behavior and their punishments. But criminal laws can have harsh consequences and should be saved for the worst crimes. Yet these laws continue to be misused against the most marginalized. They separate people from their families and can have a negative impact on public health. They make people afraid to seek help and to protect themselves from HIV. And they get in the way of countries adopting more humane, effective approaches. We need helpful laws applied in helpful ways to avoid leaving the most vulnerable people behind. Countries have committed to reform laws that criminalize people living with HIV and at risk of contracting HIV. It's time to keep our promises and focus on what is really needed to protect everyone's health, protect everyone's rights.
And so the message is clear. We have to protect everyone's rights, regardless of whether their lives are very different from our own or whether they make different choices from us. At this point, a quick housekeeping note. Please feel free to leave any questions or comments you have in the chat, and we'll be sure to get to them. We have one of our team members who will be answering some of the questions along the way, and then we'll of course pose some of the questions to our panelists and to our experts. So now we're going to shift to our U=U focus for today's event. What does that have to do with human rights? Well, a lot of the rights violations that people living with HIV experience flow from the idea that they have an infectious disease. But what if we could support people living with HIV so that they're no longer infectious? Today we're going to explore the possibility of the U=U concept to change attitudes to people living with HIV and therefore to create a more enabling environment for them. We're going to hear now a clip from Dr. Jakkrapatara Boonruang, who is a research physician with IHRI, the Institute of HIV Research and Innovation, based here in Bangkok.
So U=U stands for undetectable equals untransmittable. So when people living with HIV, they have anti-HIV positive, right? And then they have to take the ARV medications, the antiretroviral medications, to suppress the HIV virus in their body. And when we get their blood tasted, we will also taste for HIV viral load, which is the quantity of HIV virus in their blood, right? And when they are adhering to that regimen and the viral load becomes undetectable by the test, it means that they cannot transmit HIV to another individual without HIV through sexual activities. There are a lot of factors that contribute to undetectability of HIV viral loads. So when people living with HIV were diagnosed with HIV, it depends as well on their status, whether they have a lot of viral loads in their body or not, which regimen they are taking. But when they are taking these new versions of ARV, typically TLD, they will be able to achieve undetectability within 3 to 6 months after the initiations. But that also depends on their adherence to the ARV regimen as well. Okay, so one person, if they want to know their HIV status and HIV viral load amount, they have to get their blood tasted. So, of course, you have to get tested first to know that you are living with HIV. And after you initiated the treatment, after 3 to 6 months of follow-up visits, the doctors will also prescribe another test called HIV viral load or HIV RNA testing to determine whether you are still, have HIV viral load in your body or not. So HIV treatment now is actually very easy. We comes from the era where you have to take a bunch of pills per day, in order to keep your viral load down. And now we progress to the era where only 1 pill per day can actually help you achieve that. In a lot of countries, we have the regimens called TLD, and that is a 1 pill regimen that you need to take punctually every day. And for 3 to 6 months after you've been consistently taking these pills, you can actually achieve undetectability, and therefore you will not be able to transmit HIV to your partners or to your children. We do know that U equals U is a scientific fact because of the 3 main pivotal studies. These studies' names are Partners 1, Partners 2, and Opposites Attract. And Opposites Attract study itself has been conducted here in Bangkok, Thailand. These studies recruited up to 1,800 serodiscordant couples. And when I said serodiscordant couples, I mean that one person is HIV negative and one person is HIV positive. However, those who are living with HIV in this couple, they are all undetectable in terms of viral load. And after years of follow-up visits and blood tests, and after 100,000 condom-less sex acts reported in these studies, they find no or zero linkage of HIV transmissions among these couples. So we know for a fact that people who are undetectable cannot transmit HIV to their partners. The populations that were conducted in these studies that I've mentioned before are serodiscordant heterosexual couples, so male to female, and homosexual male serodiscordant couples, so male and male, with emphasis on sexual activities, for example, penile to vaginal sex, and also anal and penile sex. We also apply U equals U concept to some sexual activities that has not been reported about the risk of HIV transmissions. For example, sex that involve neovaginas or sex that involve neophallus for trans men or trans women. For U equals U can also be applied to them. So basically, all genders of all populations who engage in sexual activities, they cannot transmit HIV if they are undetectable. There are a lot of conversations about mother-to-child transmissions, or what we call in medical field vertical transmissions, and U equals U concept as well. There has been a lot of studies that report that women or mothers who are achieved viral load undetectability during the conceptions, during the pregnancy, and at delivery, they cannot transmit HIV to their children. So the vertical transmission of HIV will also be included in the U equals U concept. U equals U actually tremendously changed my client's life, especially those living with HIV. So previously, before U equals U concept has been established, there's nothing for them to strive for. There's no goal for ARV treatment. Of course, a lot of providers advise them that ARV treatment will keep them alive and healthy, but sometimes that is not enough for people to feel like that's the goal that they want to strive for. there's no sense of returning to who they were before the infections, and U equals U actually changed that. It gives the notions of liberations and a sense of you can become who you were again once you start the treatment and achieve this destinations. When U equals U concept comes, it means that they can actually and fully enjoy the intimacy sexually to your partners, and mothers can now deliver their children without the fear that their children will get HIV. So I think it changed a lot of perspective, and it transformed actually the perspective of HIV, and now it becomes something like a mantle of hope and empowerment for people living with HIV.
A whole new world, and we need to get the word out so people know. That full interview will be available on our social media channels, so look out for it in the coming days. And now we'd like to transfer to our panel discussion, and this is a panel with a difference because it's made up of the real experts, people living with and affected by HIV. So first from Pakistan, we have Shan Ali. He's a community outreach worker with Dostana, and he works on HIV prevention among men who have sex with men and male sex workers in Punjab, and he's joined by his interpreter. And we have Bella Aubree, Executive Director of Inti Muda in Indonesia, which advocates for the rights of young people. And make sure to check out our World AIDS Day report because Bella is featured. And welcome as well to Adrian Lindayag. Adrian is an actor, but he's also working with LoveYourself in Philippines, and he's a U equals U advocate. And from India, we have Karun Lama. She is the communications coordinator at 7 Alliance. Karun actually lost both her parents to AIDS, and she will offer the perspective of someone affected by HIV. So Adrian, let me begin with you. We've been talking about the importance of taking the rights path. Could you share a bit about your personal experience of having your rights violated or undergoing stigma and discrimination?
Honestly, I haven't. I've been living with HIV since 2017, and it's an information that is mainly private that I share with not just with my medical team and my family only. And so I only publicly shared my status a couple of months ago, and I honestly have not received any discrimination, but I have witnessed it in being done to other people. And so I recognize that maybe I am shielded from that because of my privilege, because of being an actor, being someone in the public eye. And I think it is a bonus for me to share that privilege to the very community that I'm part of by raising awareness and just owning my truth and sharing that to the world.
Thanks so much. But could you share with me some of the things you've observed? What do you observe other people living with HIV experiencing in Philippines? What are some of their stories?
I think I have lost friends to HIV and AIDS, and that is because of the shame surrounding and the stigma surrounding the virus, the lack of education, because they were afraid to first get themselves tested, or if they do get themselves tested, they just give up on their dreams, give up on their lives. They don't adhere to treatment. And I think that's the main thing. We do not see enough people talking about HIV. We do not. I think the information is, at the moment, honestly, too intellectualized, that it's not accessible to the common man. It's not accessible to the younger generation, which is the generation or the population that needs to focus on. The children are the future. I believe the children are our future. That Whitney Houston said that, but they are the people that we need to reach with the information that we have. But yeah, the information needs to
Agreed.
be more accessible.
Agreed. Bella, may I ask you, could you share the stigma and discrimination that you may have experienced?
Yeah, so I experienced stigma, not only because I am as a transgender woman, but also I am like people living with HIV. But there is another layer that I got stigmatized, which is because I'm young. Because technically I'm 22-year-old now, and then when I was diagnosed, I was 16. It's under 18, so I'm so young at the time, so I got stigmatized like triple because of I am a trans, I am living with HIV, and I am young. Because when I come to health services, it's sometimes like they have a different judgment in terms of young people. And I say, oh, okay, all services, all HIV services are welcome for key population, like for transgender, for drug user or sex worker. But if they are young, like the healthcare workers will be like judging, like, why are you doing this in the young age? And that is always happen like back then, but we also in Inti Muda try to address that issue. So we want to sensitize the healthcare worker, especially because that kind of stigma and discrimination that happen makes me don't want to go to health services. And I think all young people who are living with HIV also don't want to go to health services if they get stigmatized like that, because they still think that, okay, because you are young, you can still, like convert not to be transgender or something like that. So the judgment and stigma because of like the age is real. And it's also like not only in terms of healthcare services, but like people in general always think that, oh, that's so sad if you get HIV in a young age. But also because of that kind of situation, it reflects to be I have also self stigma, and this is really really bothering me, and I think this is also really affect my mental health.
Important point about the layers of stigma and the layers of vulnerability, that we can't just attack the issues one by one. We have to look at the intersecting ways in which people are vulnerable. Thanks, Bella. Let me go to you, Shan. Could you please share your experience of stigma and discrimination?
My experience stigma and discrimination. हाँ मुझे 2 साल हो गए हैं, 2 years, ठीक है, HIV पॉजिटिव। तो सबसे पहले मुझे ये था कि मुझे डिपोर्ट किया गया जहाँ मैं काम करता था, ठीक है, कतर से, ठीक है, जिसकी वजह से मुझे बहुत ज़्यादा यानी कि परेशानी हुई, मुझे फैमिली में बताना पड़ा, और मुझे फैमिली ने भी कहा कि अब तुम्हारा क्या होगा, ना कोई जॉब है ना कुछ और काम है। तो जिसकी वजह से मुझे बहुत परेशानी हुई, और मेरी फैमिली को भी इतनी एजुकेटेड नहीं है, ठीक है, जिसकी वजह से वो मुझे हर टाइम यानी कि करते रहते हैं, खराब करते बताते हो। So Shan is saying it's been 2 years since he was deported from the Gulf state because of his HIV status, and it completely turned his life, as he was also fired from his job and he had to come back to Pakistan. He had to disclose his status to his family, and it created multiple problems for him. And it's been 2 years since he has been experiencing all of this and fighting all of this, and now he is on treatment, and he is undetectable.
And could you share a bit about the impact of this on your life? Tell me a bit more about what you have gone through, how it has made you feel, what has been the effect of all of this?
यानी कि पूरी जिंदगी में चेंज आया, ठीक है, कि खाने पीने में, यानी कि खाने पीने में, सोने उठने में, हर जगह पे चेंज आया, ठीक है। उसके बाद यह था कि सबसे बड़ा इशू था कि जॉब का। उसके बाद दोस्त, यानी कि हर चीज़ यानी कि छोड़नी पड़ी, दोस्तों को भी कुछ को पता चल गया, जिसकी वजह से हर टाइम यानी कि बस जहन में ये होता था कि अब क्या होगा क्या नहीं होगा, जिसकी वजह से बहुत परेशानी होती थी। तो अभी मैं रिसेंटली इधर काम कर रहा हूँ, ठीक है। और यानी कि हर जगह मैं जब जाता हूँ लोगों को बताता हूँ, जिसकी वजह से लोगों को बहुत फ़ायदा भी होता है, ठीक है। और बाद ऐसा भी होता है कि जिनको समझ नहीं आ रही होती उनको मैं अपनी लाइफ के बारे में एक्सपीरियंस बताता हूँ, तो वो उनको यानी कि थोड़ा बेटर फील आता है।
So he's saying it's been 2 years and it has completely changed his life in a sense that he faces a lot of discrimination. He had to disclose his status to his family, and a lot of his friends who came to know about his HIV status were discriminating towards him, and some people rejected him. His Some of his partners had rejected him, and it completely changed his life. He felt a lot isolated, even from the family and from the friend circle. So in that sense, he was isolated, and he felt stigmatized. And he's also saying that now that he's working for the community, for the key populations in Pakistan, he feels a sense of purpose, and now slowly and steadily he has regained control over his life and his mental health.
Thanks so much, Shan. So many issues there: mandatory testing, restriction on stay, the ignorance, the lack of education of family members, of friends. So many layers of difficulty, but wonderful that you've been able to become empowered and take ownership of your life and do something positive. Let me turn to you, Karun. How are you, or how have you been affected by stigma and discrimination if you're not actually living with HIV?
The loss of my both parents due to HIV-related complication was a traumatic experience. One of the most difficult experience was the rejection from my own family. When I lost my father at the age of 9, my family boycotted us, saying that they won't take our responsibility, and after that they never contacted us. But after 5 years of my dad dying, my mom died, my brother and I were all alone without any support, and we both were young. I was depressed and I was on depression treatment for a long time. Like, when I was battling for depression, I was not able to continue my day-to-day life. And at the time, I was seeking for the love and care from the family members, but they were never there. With this platform, I would like to thank to Rajiv Kafli from Nepal, who is activist, who gave me shelter and care and opportunity to work in this field, like many other people living with HIV that he was at the time caring and fostering to. Not only that, when I went back to hometown to make my documents, because documents is very important to live my life, and it is one of the part of the human rights. But when I went back to home to make my documents, my family member misunderstood me, thinking that I am there to take over the family wealth, and they created lots of challenges or barriers to get my own documents. But after lots of struggle, I was able to make my document, and I never looked back. So I would say, despite these all challenges, I was determined to overcome adversity. I realized the importance of resilience and empowering myself so that I can advocate for me and for all the young people like me. Thank you.
Thanks so much, Karun. Again, a story of overcoming adversity. But the other thing that's so important is for us to realize the stigma and discrimination is not just in healthcare settings. It's in communities, it's in families. And that very much goes to the heart of what the difficulties, the challenges that people encounter. So Adrian, let me ask, when you first heard about U equals U, what did it mean to you? What was the value of this concept for you?
I honestly didn't know about the concept of U equals U before learning about my status. I it was my doctor who educated me about it, and it changed my life radically. It gave me hope that I'll be able to still be able to achieve my dreams and live a normal and healthy life being despite the status. And it is just a status, and it makes everything else still possible because of that. I wish more people knew about that, and so thank you for this event, because this event is another way to help spread that information.
Thanks so much. And Bella, what about you? At what point did you learn about U equals U? Because it sounds as though when you were first diagnosed, the environment wasn't very supportive. So when did you learn about U equals U, and what difference did it make?
Yeah, so basically, a 16-year-old girl like get infected by HIV and clueless. Like, she has a self stigma. Like, will I, uh, will I be die soon or something like that? But then I am privileged to search the information, because I think at that time the message of U equal U is not that spread well. So I'm not getting the information from the health services, but I get the information from Google and also social media. I learned that, and I try to understand that, and it feels like, oh, okay, there is a little bit hope at a time, because I'm not really understand well. But then I also tried to reach out and the health services to better understanding about the U equal U means, and it really makes me getting more hope, because like 16-year-old, and what's next? Is it possible for me to go to the next education or getting a job or something like that? And the U equal U for me, it's giving me hope. And also at a time, I always feel like, oh, I feel bored of consuming RFE. And I think because I know that at some point I will be undetectable, which is that means untransmittable, and I am like ambitiously to always take the RFE every day, because sometimes this rotation is quite challenging for young people as well. So that also helped me to take the RV every day. Like the motivation is come from there.
So in 2024, would a young person who is diagnosed in Indonesia now be able to get information about U equals U from a clinic, from their healthcare provider?
Yes, it's all available in healthcare providers and also social media. We are doing a big campaign for the U equal U. We are also like collaborating with the Ministry of Health to spread U equal U from the healthcare services, so it will be more effective.
Wonderful. Shan, question to you. What is the impact of U equals U on your life?
सबसे पहले यही था कि जब न्यू न्यू डायग्नोज हुआ था, तो सबसे पहले यही था कि अब मैं अपनी वजह से किसी की और ज़िंदगी क्यों ख़राब करूं, क्योंकि मेरा पूरा कैरियर ख़त्म हो गया, मेरी जॉब ख़त्म हो गई है, तो जिसकी वजह से मुझे बहुत परेशानी थी। तो जब मैंने आस्ते आस्ते इसको लर्न किया, ठीक है, एआरटी सेंटर से मैंने इन्फॉर्मेशन ली, डॉक्टर से यानी मैंने कंसल्ट किया, तो उससे मुझे बताया, तो फिर यानी कि मैंने कुछ आस्ता आस्ता अपनी ज़िंदगी में चेंजिंग लाया। जब मैं नॉन डिटेक्टिव हो गया, तो उसके बाद फिर मैंने आस्ता आस्ता यानी कि अपनी ज़िंदगी को नॉर्मल उसी तरीके पे लाने की कोशिश की, ठीक है। जब बंदा न्यू न्यू यानी कि मैं हुआ था, तो तब मुझे इसके बारे में कोई इन्फॉर्मेशन नहीं थी। और पाकिस्तान में भी ऐसे ही है कि जिस बंदे को भी अगर एचआईवी का बताया जाए ना, तो वो पूरी इन्फॉर्मेशन नहीं लाता, वो कहते हैं नो नो नो, इट्स ओके ओके फाइन, ठीक है। बंदा लर्न इसको तब ही करता है जब वो खुद इन्फेक्टेड हो, या खुद इस काम कर रहा हो इस चीज़ में, तब वो पूरी इन्फॉर्मेशन रखता है, ठीक है। तो ये दो बंदे ही होते हैं जिनको ये पूरी चीज़ का पता होता है, ठीक है। तो अगर पाकिस्तान में ज़्यादा कैंपेन चलाई जाए, सब ज़्यादा से ज़्यादा यही ज़रूरत है कि सबको इस चीज़ का पता होना चाहिए, चाहे वो इन्फेक्टेड है या नहीं है, ठीक है। लेकिन जहां तक ज्यादा इंफॉर्मेशन की जरूरत होती है कि सिर्फ जो इन्फेक्टेड होता है या उनको पता होता है या जो इस चीज में काम कर रहा होता है उसको पता होता है।
Okay, so Shan is saying initially he had no information about U is equal to U, but slowly and steadily he got to learn about U is equal to U, and now he is trying his best to promote this message and make people aware. Another thing is that he is pointing out that on in Pakistan right now there are only two people who know about U is equal to U. One is the service provider who knows the mechanism of U is equal to U and is aware about that. And the second part is the people who are living with HIV, they know about U is equal to U through the medical centers, but the general public, they have no idea about U is equal to U. So if we do a bigger campaign, like the other panelists told, in our country, in Pakistan, if we run a big campaign, that will be effective and more people will get to know about U is equal to U, and it will make life easier for all of us. Generally.
So you've begun to answer my final question already, like how do you think we can use this U equals U concept to transform attitudes and culture and the way that we treat people living with HIV?
पाकिस्तान में सबसे ज़्यादा यानी कि एरिया पे डिपेंड करता है, ठीक है। यानी कि सिटीज़ के लिहाज से हो सकता है कि कुछ सिटीज़ हैं जिनमें ज़्यादा एजुकेटेड लोग हैं, ठीक है, उधर कंपेन करना भी आसान है और लोग समझ भी लेते हैं, ठीक है। और कुछ सिटीज़ में ऐसे है कि कुछ लोगों को तो HIV का पता ही नहीं होता, ठीक है। अगर कुछ को बताएं तो वो कहते हैं कि नो नो हम तो सेक्स करते ही नहीं हैं, ठीक है, और हमें ये चीज़ हो ही नहीं सकती, ठीक है। वो कहते हैं कि हमारा इससे दूर दूर तक तल्लक ही नहीं है। तो सबसे बड़ी चीज़ ये है कि इस चीज़ को एक्सेप्ट करना चाहिए और इसको यानी कि एहतियातन टेस्ट करवा लेना चाहिए, ठीक है। इसके इन्फेक्टेड होने के बहुत से तरीक़ेकार हैं, ठीक है। तो सबसे बड़ा ये है कि सोशल मीडिया पे, स्कूल्स में, कॉलेज में, यानी कि हर जगह पे यानी कि कंपेन होनी चाहिए और नॉर्मल तरीके से बताना चाहिए कि इस चीज़ से आप कैसे बच सकते हैं। और सबसे बड़ी फैमिली में पता होना चाहिए, भाई या फादर इस चीज़ को अपने बच्चों को बताए कि ये किस तरह, अगर आपने सेक्स में इन्वॉल्व हो तो आप कॉन्डम का इस्तेमाल करें, जो भी है। तो यहाँ तक कि अगर आप स्टोर में भी कॉन्डम लेने जाते हो तो अगर वो दुकान आपके मोहल्ले में है तो वो आपके भाई को बता देगा कि आपका भाई आज कॉन्डम लेके गया था, ये क्या करता है, क्या काम करता है। तो इसलिए ये बहुत ज़्यादा यानी कि इंफॉर्मेशन देने की ज़रूरत है।
Okay, so Shan is basically pointing out two things. The later part was that we need to raise awareness about sexual and reproductive health and rights in Pakistan. And initially, he said that when it comes to U is equal to U campaign, we should start with the bigger cities in Pakistan, as people are more aware and educated and more accepting and understanding towards the HIV prevention methods. And if people in the bigger cities get to know about U is equal to U, the impact would be greater. And then later on, we can start the campaign or pursue the campaign in the smaller cities. Also, Shan is saying that social media will play an important role because social media is a tool of education that is used in Pakistan right now. And if we use it in a correct way, it will create a greater impact.
Fabulous, fabulous. And we're on the same page. We're going to try. We're going to do that work. Adrian, let me ask for your big idea of how we can use U equals U to turn the situation all around.
When I helped my family understand the concept of U equals U, I think it transformed the way they viewed me and other people living with HIV, and it allowed for them to realize that it's okay for me to share utensils with them, and we can still eat together, and I can still have a partner. I am now happily in a romantic relationship with someone who accepts me, and he also understands the concept of U equals U. And I think sharing about that will also do the same thing for more people. But I think we need to make the conversation around HIV or anything scientific in general be more accessible, be more casual, so that more people will. Because a lot of people, I believe, are intimidated with to listen to conversations regarding science and viruses, and there's a lot of jargon and scientific terms, and that makes the normal or the common person intimidated to talk about it as a topic. So I think we need to work towards casualizing information and discussions regarding these things. With Love Yourself, one of the NGOs, one of the organizations that I work with, we work a lot with millennials and Gen Zs, and we try to create campaign videos and graphics that are shorter, easy to digest, more fun. We incorporate games, and just, we need to reach more people. I think we'll be able to do that by becoming more accessible.
Absolutely. And once again, this is also an assignment for me, for us at UNAIDS, to work together with communities and, like you say, to make the messages shorter, more fun, more accessible, and speak directly to young people. Another thing you mentioned, and it's come up so many times this week, talking to people living with HIV, this thing about not being able to eat with somebody living with HIV. Even before U equals U, you can kiss, you can share utensils, you can share food, yet there is this persistent thought in people's minds as though HIV is something that's easy to contract. So definitely we have a lot of work to do in terms of just HIV basics. This is how it's spread, this is how it's not spread. And U equals U strengthens even more that security that people feel about being loving and kind and sharing with people living with HIV. Bella, let's get your idea of how U equals U could help us end HIV stigma and discrimination.
Yeah, as I said to you, like I experienced like with the U equal U, it increased the retention. It makes me like have a motivation to consume RV. And not only that, U equal U is really useful to decrease stigma and discrimination as well. But sometimes in Indonesia, it's also not that easy to make all people understand U equal U. But also I think it's really important to us to still spread this information, especially for the next generation, for the young people. So maybe the new people in Indonesia or in this world have a better understanding in terms of U equal U. And I know it's not hard, but again, it should be also we have to focus on the basic thing, like HIV basic, because it's sometimes people still didn't know about that information, and they still have to spread that information in school or anything else. So this U equal U could be effective for decreasing stigma and discrimination for the people living with HIV, but it's not easy work. So we have to still collaborate to spread this information.
Absolutely, absolutely. And last word to you, Karun. How do you think we could use this new concept, this new tool that we have at our disposal?
First of all, since I was advocating, I'm like 15 years old, I was well known about the importance of condom, but there was always concern, what if even having a safe sex, there is mishap happens like breaking condoms, but when I heard about U equals to U in 2018 during the International AIDS Conference, I feel like there is now progress in HIV, and fortunately the U equals to U message changed everything for me, because I'm not only the young woman affected by HIV, but I am also a serodiscurrent couple, and my partner is living with HIV. And we are well known about like viral load suppression, importance of viral load suppression, but in India, where family and relatives consent is very important when we are in a committed relation, it was very difficult for us at first to make them understand, because my partner's family and relatives were scared and concerned for me. They thought that like my partner, as being living with HIV, like he is putting my life at risk, and he should get married to a person living with HIV only. But we've sensitized them with U equals to U, and they begin to understand that we can also live a life together happily, and he won't transmit HIV until his viral load is suppressed. Definitely, this takes lots of time to make them understand regarding this. But yes, I would say the sensitization with proper education, with proper evidence is very important. And nowadays, we all are so much active in the social media. So social media campaign, and also webinar like this, where we can share our own story, helps to reach um, at grassroots level, and also make people realize that people can live with HIV in a happy relation, and also they can have a family. Yes.
I am
Thank you.
so glad that you brought that up, because actually in our interview with Dr. Jakkrapatara, he mentioned how important it is to counsel family members as well, so they can get the information, and that will ease their minds and they won't worry as much when they know about this new tool. So definitely look out for the full interview that we're going to release on World AIDS Day, so we could begin getting the word out. We're going to have about 15 minutes for all of your questions for the panel. And let me at this point introduce Dr. Bridget Quenham. She is UNAIDS Sciences, Services and Systems Advisor. Quite a mouthful. And she is here to answer any of the technical questions you may have. And also feel free to send some questions through for any members of our panel. Bridget, first question to you. Is there any difference in terms of how U equal U works for key populations as opposed to the general population?
Can you hear me?
Yes.
Yes. Hi, Adrian.
Hi.
Hi, everyone. It was wonderful to hear all the expertise and experience sharing from all the panelists. As themselves said before, U equal U is science-based, and all that have been said, all available evidence suggests that people living with HIV who have an undetectable viral load have zero risk of transmitting HIV sexually, and those who with a suppressed viral load, detectable but under 1,000 copies by ml, have almost zero risk of transmitting HIV to sexual partner. Though these include not only general population, but also key populations, except the transmissibility of HIV by sharing, injecting drug use equipment when a person's viral load is undetectable or suppressed has not been studied. So it doesn't apply for sharing, injecting drug. Even with an undetectable viral load, anyone who injects drugs should always use clean, new equipment and never share the equipment. Over to you, Adrian.
Thank you. So U equals U is U equals U for anybody, regardless of who you are when we're talking about sexual transmission. Okay, so it doesn't matter if the person is gay or straight or trans. If they're undetectable, they're not going to be able to transmit sexually. Thanks so much, Bridget. And another question here is about late access to testing and people being diagnosed very late. And of course, that's what we want to prevent. We want people to be diagnosed early, start treatment right away so they could achieve U equals U. But the question is, how do we get people to overcome the fear in order to learn their status? Bridget, first, in the first instance, do you have any response?
Yeah, we heard some elements of the response from some of the panelists. One point, U equal U can increase the uptake of HIV testing services through peer-delivered messaging about U equal U. This is why it's really important that the community networks are involved, the community actors are involved. And there is available evidence that reports that such intervention doubled the proportion of people who came to a mobile clinic for free HIV testing. And besides that, it's also important to diversify the services catered to the need of key population to ensure that they are accessible to the services they need. So really important for uptake of HIV testing services. It's important also to U equal U, it's also important if we want to improve treatment adherence and viral suppression. So this is key. And accessing the people being tested, first step. But you need to link them directly to the care services to ensure that they are on treatment and that their viral load is suppressed until become undetectable. And this is how we all want the goal. At the end of the day, we want to achieve U equal U for people living with HIV or key population need of services. And important thing, U equal U, as it was also already shared by the panelists, it's improved the quality of life and well-being of people living with HIV, impacting the life expectancy. So it's really important that beyond the zero risk of transmission, it's important to keep in mind and understand that there are many benefits, and we need the community and organizational level intervention to make much more progress on U equal U and to inform, to sensitize how it can be used, including to improve HIV literacy. And many of the panelists explained that we need more campaign, we need a bigger campaign, we need to raise awareness, to even to go to the basics. Some of the youth entering first sexual intercourse sometimes are no longer informed, so we need really to go to the basics. And U equal U, it's really an opportunity, a game changer.
Yeah, agreed. And so it's really interesting how sharing that message about U equals U could actually help increase demand for testing, because people know if the test is positive, I have a solution, not just a solution that will keep me alive, but a solution that will ensure that I'm not infectious. I can't pass this on to anyone through sex. Adrian, I also want to ask you that same question based on the work that you've already done with Love Yourself. What do you think we need to do to help people overcome their fear of getting tested?
U equals U is actually a good starting point to educate people, so that in order for them not to fear, let's assure them that their lives will still be normal and that their dreams are still achievable, even despite the status. But also, I really believe that fear comes from not knowing. or knowing the wrong thing. And there's so much misinformation still going around, and it's already 2024. In a couple of weeks, it's already 2025. But there's still so much lack of information regarding this. We need to work more with our governments. I think we don't receive enough support from our government, especially Department of Education of each country, to help us spread this awareness and this education to the schools. And I think they're the most important, most vulnerable population that we need to focus on. We need to educate the youth as early as possible.
Great. And Bella, a question for you. Someone mentioned that even health workers have limited knowledge, not just about U equals U, but sometimes about HIV treatment in general. Could you give some insight into how this could be addressed? What approaches can we take, not just as governments, but from the point of view of community, to help support healthcare workers to bone up on their knowledge and their ability to deliver services?
Yeah, so we are currently had a lot of works in Inti Muda to give the sensitization for the healthcare workers in terms of HIV and also how to approach young people population and young people living with HIV. But yeah, that is not so sustained because we need money to train them. But we want also like to see the responsibility of the Ministry of Health to deliver the information to the healthcare services, because that is their mandate. And we are currently also push in the CLM to push the U equal U message, especially for the healthcare workers to the patient, because that's really important. And I think it should be the healthcare workers, especially working in the HIV, should be really know about that issue. But let's say we also want to like the integration between all services, and they should be at least know about the HIV services, and it should collaboration between all sector and multi-stakeholder as well. Like like it's not only healthcare services that handle HIV who really know well about HIV, but also in terms of like the healthcare services in the mental health issue should be also known and informed, because most of like people living with HIV are also access that health services. So maybe it should be like the exchange learning or like transfer knowledge between them. And I think this is also crucial because we are also pushing the integration of the health services. And I think it should be, all services should be more friendly and more understand about HIV itself.
Very important point about the need to have comprehensive services. When someone drums up the courage to come to get care for whatever reason, it could be STIs, it could be HIV, we should be able to offer them all of the services that they need, all of the screenings necessary, and we have to make sure that all the different healthcare providers are able to do the necessary referrals and give the person the information and support they need. Thanks so much, Bella. There's a story in the chat, a very sad story from Erwin Espinosa. He says, in 2012, my partner passed away, and it was a painful experience that exposed me to the harsh reality of stigma and discrimination. His grave was completely sealed with a plastic cover and packaging tape, with every edge of the coffin meticulously closed. I mean, that just paints a picture of how profound the stigma and discrimination can be and how irrational it might be. Shan, let me ask a question. In terms of the experiences that you encounter of men having sex with men, the male sex worker community, what are some of the examples of the stigma and discrimination that they experience, and how do you respond? How do you support them to respond to such profound prejudice?
बारे में बताओ. हाँ, हाँ, सबसे सबसे जो बुरी चीज़ है वो यही चीज़ है कि जब आपको आपकी यानी कि आपका कोई भी काम नहीं होता आपका, ठीक है। सबसे पहले लोग कहते हैं, जब इसको डॉक्टर के लिहाज से देखा जाए तो वो कहते हैं कि ये कोई बीमारी नहीं है, ठीक है, जस्ट वन टैबलेट एंड इजीली लाइफ, ठीक है। उसके बाद सबसे बड़ी स्पेस आती है जॉब वर्क पे, ठीक है। जब आपको काम नहीं मिलता, ठीक है, जब आपको वर्क प्लेस पे यानी कि हर टाइम आपको इस चीज़ को फेस करना पड़ता है, ठीक है। तो इस वजह से बहुत परेशानी होती है कि यार ये क्या हो गया है मुझे, और ये कब ये खत्म होगा, ठीक है। तो सबसे यानी कि बड़ी चीज़ ये है कि आपको वर्क प्लेस पे यानी कि इसके अच्छे अच्छे कवानीन होने चाहिए, ठीक है। और इसको मजीद यानी कि एक्सटेंड होना चाहिए कि आपको जहाँ भी आप काम करो आप नॉर्मल तरीके से यानी कि रह सकते हो, ठीक है। यानी कि कुछ स्पेसिस ऐसी हैं या कुछ वर्क प्लेस ऐसी हैं जहाँ पे आपको काम करने में बहुत रिस्ट्रिक्शन होने यानी कि होती है, ठीक है। आप मेरे स्टेटस की वजह से मैं ट्रैवल नहीं कर सकता, ठीक है। जहाँ मैं आई हैव 2 years एक्सपीरियंस पाइप फिटर, ठीक है, लेकिन वो मेरा अब किसी काम का नहीं है। मैंने कतर में काम किया हुआ है, लेकिन अब मेरे स्टेटस की वजह से मैं जिस काम का मुझे कोई पता नहीं था अब मैं उस काम को यानी कि कर रहा हूँ, ठीक है। लेकिन अब उस काम में भी मुझे अच्छा लग रहा है कि मैं जैसे जो एक्सपीरियंस मेरा है, जहाँ मैं बहुत सारा एक्सपीरियंस यानी कि जो न्यू न्यू लोग इफेक्ट होते हैं मैं उनको बताता हूँ, तो वो इस चीज़ को एक्सेप्ट करते हैं और अपनी नॉर्मल तरीके से लाइफ गुजारते हैं।
Okay, so Shan is saying that the biggest discrimination is when you are working somewhere and you have experience there, but you are forced to have HIV test and the results are not even reported to you. And he is saying he had like 2 to 3 years experience as a pipe fitter in when he was in Kuwait, but he was forced to take HIV test without his consent. He didn't even knew what the test was for, and now and not only this, he was pushed out of the job. He was forced to quit and he was deported. Now he's saying that he cannot travel back to Qatar or any other Gulf state, and the experience that he had in the job that he was working, it literally went to drain, and now he has to restart his life and gain experience in a totally completely different field.
एंड वन क्वेश्चन, सबसे बड़ी चीज़ ये है कि अगर आप पाकिस्तान में हो, ठीक है, तो आपको मुख्तलिफ किस्म की यानी कि एनजीओज मिल जाएंगी या सीबीओज मिल जाएंगी जहाँ पे आप अपनी कम्युनिटी के लोगों के साथ यानी कि अटैच होकर आप टेस्टिंग करवा सकते हो या प्रेप हासिल कर सकते हो या पैप इस्तेमाल कर सकते हो, ठीक है। लेकिन कतर में पूरी एक लेबर सिटी था, ठीक है, और थाउजेंड ऑफ पीपल, ओनली लेबर, थाउजेंड मैनी थाउजेंड पीपल यानी कि उधर रहते थे, ठीक है। और उनको इस चीज़ में नो कॉन्डम, नॉट प्रेप, नॉट पैप एंड कुछ भी नहीं इस्तेमाल करने देते थे, ठीक है, बस ओनली वर्क वर्क। लेकिन जो एमएसएम कम्युनिटी है, गे लोग हैं, जब वो हजारों लोग एक जगह रहते हैं तो ठीक है कुछ ना कुछ हो ही जाता है, ठीक है। तो वहाँ बहुत ज़्यादा रिस्क होता है, ठीक है। तो वहाँ हर 3 महीने बाद, 6 महीने बाद आपकी टेस्टिंग होती है, ठीक है। टेस्ट पे वो जोर देते हैं लेकिन इस चीज़ को यानी कि ठीक करने की कोशिश नहीं करते। उन्होंने अपनी नेशनल के लोगों को यानी कि सेफ्टी देते हैं, जो आउट ऑफ कंट्री के लोग होते हैं उनको कुछ भी नहीं बताते, ठीक है। अगर आपके पास कॉन्डम निकल आए हैं या कॉन्डम यानी कि इस चीज़ को वो बहुत गलत समझते हैं, ठीक है। अगर मैं भी उधर उधर थाउजेंड ऑफ पीपल के साथ होता तो मैं कॉन्डम यूज़ करता या मुझे कॉन्डम की अवेलेबिलिटी होती, ठीक है, उसके बाद प्रेप होती, तो मैं आज इस हालत में ना होता।
Yes, so Shan is raising a very important question, and that is he's directing it towards all panelists. He's saying that in Pakistan we find a lot of NGOs and CBOs working for HIV prevention, but when he was in Qatar and the other Gulf states, he is pointing out that every 3 to 6 months people are forced to have these medical tests, but the use of condom is very rare among those work cities. And he's also saying that if you are found with condoms, you are frowned upon. And they don't have any prevention services or community-based organizations or NGOs working on HIV prevention in the Gulf states. So
हाँ,
he's
यानी कि मैं उधर कोशिश करता था कि मुझे किसी तरीके उधर से कॉन्डम मिल जाए या प्रेप मिल जाए। अगर मुझे पता ही नहीं था कि प्रेप लेनी कहाँ से है, क्योंकि ना उधर कोई CBO ना, तो अगर उनके हॉस्पिटल जाओ तो वो सिर्फ अपने नेशनैलिटी के लोगों को ही सिर्फ प्रोवाइड करते हैं, पता नहीं देते हैं या नहीं देते। तो मुझे इस चीज़ का कुछ भी नहीं पता था। मैंने बहुत कंट्रोल भी किया उधर, लेकिन फिर भी मुझे इस चीज़ की यानी कि नहीं मिला, ना प्रेप मिली, ना प्रेप मिली और ना कॉन्डम मिला। और लेबल सिटी से ऐसा होता है कि आप बाहर भी नहीं जा सकते, तो हजारों सिर्फ मर्द मर्द एक जगह पर रहते हैं, ठीक है, और सिर्फ काम और अपने रूम में सोना।
Yeah, so he's saying thousands of men were living in the same labor city, and there was absolutely no prevention services available to them. Even if he wanted to get condoms, it was really hard to get condoms from anywhere, and there was no system in place to have to access to PrEP or PEP or testing or even condoms. So that's what made it very difficult for him, and he just wants to know, okay, why there are not such systems in place in the Gulf states.
Right. Thank you so much. So many issues, and it emphasizes that we have to address the stigma and discrimination and the human rights infractions at all levels. There's a policy and legislative dimension to this. There is a community dimension to this. The fact that we need, as you said, community support, community workers providing these services, providing information, providing commodities. And there is an employment as well. We need to address stigma and discrimination in employment settings to make sure workers' rights are not violated for illogical reasons. So that is our agenda, people. Final question going to Bridget. And this is a question to just clarify about this U equals U concept. Just to confirm, they're asking if a person living with HIV who has an undetectable viral load has sex without a condom with somebody who's not living with HIV, are you saying that they're not going to transmit the virus?
The person who is undetectable cannot transmit the virus. So there is zero risk of transmission to HIV to the sexual partner. However, U only protects against HIV transmission. So condoms are still the best way to prevent STIs, other STIs. So in a monogamous relationship where the two partners are undetectable, no risk. Outside of that, potential risk, that there is a need to adjust the options, the prevention options.
So the answer is absolutely, even if you have unprotected sex, once the person is undetectable, zero chance of sexual transmission to someone else. Okay, so now I know there are some other questions in the chat, including one from Jay, who's a member of our journalist network from the Bangkok Post. Jay will get back to you with an answer specifically about the Thailand situation. But at this juncture, we want to transition to talking about one of the solutions that we're working on. And let me just say thank you to our excellent, brilliant panel. And we'll be taking all of these ideas forward and hoping that we could continue to stay in touch to brainstorm ideas and come up with solutions. One of the solutions that we're working on is this mass communication. Through support of USAID and PEPFAR, UNAIDS and APN Plus have been working on stigma and discrimination reduction initiatives. And since last year, one of our strategies has been bringing in journalists and influencers, social media content creators into a network to build their capacity and also to support their storytelling about people living with HIV, stigma and discrimination. And I'd like to share one example of some work by one of the influencers. His name is Scott Alphas. He's from Indonesia and he lives openly and proudly with HIV.
Itu tadi sekilas cerita diskriminatif yang dialami oleh anak dengan HIV yang aku temui dalam perjalanan hari ini. Hai, aku Alfas dan aku HIV positif dari 2012. Hari ini aku bangun pagi banget karena mau motoran bareng teman-teman dari KDS Anak Permata Bunda dari Denpasar ke daerah utara Badung, Bali, rumah salah satu adik dengan HIV yang mau aku kunjungi hari ini. Setelah sejam lebih motoran, akhirnya sampai juga di rumah si adek. BTW aku gak bakal sebutin namanya ya. Tadi di jalan kami sempat beli kebutuhan pokok untuk adik dan kakek neneknya. Berjam-jam nyetir panas-panasan, rasa lelahnya langsung hilang setelah dapat sambutan yang hangat banget dari nenek. Belum lagi suasana sekitar yang masih sangat asri. It's my very first time sebenarnya ngelakuin kunjungan seperti ini. Tapi sejak baru nyampe pun, kalau bisa rasanya pengen ngelakuin hal kayak gini setiap hari. Adanya ini masih SMP, tapi kalau kamu pernah ngerasa kagum sama perjuangan dan semangatku, aku langsung ngerasa gak ada apa-apanya dibandingkan sama semangat si adek selama ini. Let me tell you about her. Saat ini si adek hanya dirawat oleh kakek neneknya. Iya, kedua orang tuanya udah gak ada. Tapi aku sangat bisa bernafas lega ngelihat betapa besar dan tulus cinta kakek neneknya ke dia. Dia sempat cerita juga ke aku, pernah ada di titik terendah di mana dalam sebulan minimal sekali dia harus dilarikan ke rumah sakit. Saking dropnya kondisi dia waktu itu. Aku gak mau ceritanya dilanjutin lebih jauh karena gak sanggup dengarnya dan gak mau ngerusak suasana jadi tangis-tangisan. Again, kami kesini gak pengen ngeromantisasi. Instead, pengen ngebagiin optimisme dan kebahagiaan. Kayak cuplikan video di awal. Iya, dia beberapa kali harus ngalamin diskriminasi karena lingkungan sekitarnya tahu status dia sebagai penyandang HIV. Dari denger ceritanya sebenarnya air mataku udah sempat netes. Nggak kuat aja bayangin, gadis sekecil dia harus ngadepin kejamnya stigma dan diskriminasi di masyarakat kita. Tapi apakah aura kesedihan dan putus asa yang aku lihat dari wajahnya? Enggak ada sama sekali. Justru aura dia sangat positif dan optimis banget. Dia juga sempat cerita mengenai mimpinya untuk bisa sekolah ke luar negeri, khususnya Korea sih. Iya, she proudly introduced herself as a K-popper. BTW dia ARMY guys. Oh ya, fun fact yang entah penting atau enggak, aku unofficially udah diangkat sebagai cucu oleh Dadong. Sapaan untuk nenek dalam bahasa Bali.
Halo. Halo, ini cucu saya dari Jakarta.
Sebelum pulang, ini aku sempat diajak berkunjung ke ladang buat ngecek apakah udah ada manggis atau durian yang bisa dipanen. Ya, walaupun nggak ada, karena emang lagi nggak musim. At least aku bisa bawa beberapa buah jambu air dan bibitnya juga. Sebenarnya dari kunjungan kami hari ini, in the end bukan kami yang berbagi semangat dan optimisme. Justru si adek dan Dadong lah yang banyak ngebagiin energi positifnya ke kami. Betapa aku dibuat speechless. Bayangin mereka motoran ke rumah sakit umum yang ada di kota, berdua berjam-jam di jalan, cuman buat ambil obat setiap bulan. Kalau aku pasti udah mager banget. Aku udah janji ke diri aku bakal berkunjung lagi dalam waktu dekat dan bakal lebih rutin main-main ke sini. Hitung-hitung jadi pengobat rindu rumah. Aku boleh minta tolong gak sih? Please tulisin support terbaik kamu di kolom komentar. Nanti aku bakal tunjukin ke si adek buat ngasih tahu juga ke dia kalau masih banyak banget yang sayang sama dia. Udahan dulu ya ceritanya. Makasih udah nonton video perjalananku hari ini. Semoga kita selalu diberikan kesehatan dan kekuatan ngejalani hari-hari kita. Sampai jumpa di video selanjutnya.
The power of stories, the power of stories. I'm going to hand over now to Gibby Gorres. Gibby is the chief storyteller at Gugma PR, which is a social communication firm in the Philippines, and he's also a member of the C Against Stigma network. Gibby, tell us a bit about the network and what it's working on.
Tool again. So they are our teachers, like Scott. They can also be content creators. They are children, parents, student leaders, and co-workers. Each and every one part of our community. The Southeast Asia, or C Against Stigma network, was formed within the coming together of like-minded.
Gibby, we're having a little problem hearing you. Is there something you could do so that we could hear you? Headphone, microphone.
Okay, how about now?
Okay, great. Great.
Oh, I apologize. So, stories are a powerful tool against stigma, and persons living with HIV are really not without context. They are our teachers, children, parents, student leaders, and co-workers. Each has a story to tell. So we need more storytellers. Thus, the need to enjoin content creators, social media influencers, and journalists to be part of our community of care. The Southeast Asia, or C Against Stigma Network, was formed with this in mind. It is really the coming together of like-minded creators and journalists from the Philippines, Lao PDR, Vietnam, Cambodia, Thailand, and Indonesia. We support them by providing them avenues for sharing of skills and experiences. In fact, we just conducted our digital storytelling workshop last Monday. For this year's World AIDS Day, at least 6 journalists and content creators across Southeast Asia are part of our fellowship, where they will be publishing empowering stories on the importance of U equals U using accurate and respectful language. The C Against Stigma Network is our new generation of champions who approach the issue of HIV and the people affected by it with empathy and respect, facts and inclusivity, and solutions-orientedness. People living with HIV can lead healthy and happy lives. Their stories are powerful things. So they make us feel, open minds, move policies, and inspire action. Visibility is key. And as one community, may we tell not just facts, but also stories. Maraming salamat. Thank you very much.
Thank you so much, Gibby. And so we are so excited to start this journey of sharing the power of U equals U by sharing human interest stories, by sharing the science stories, by addressing the gaps in terms of policy, in terms of law. We really do need our communicators to get the word out far and wide, so it's not just us in the little HIV bubble who know about it, but everybody knows and everybody's invested. And so one of the things that we keep hearing is that we need to, as Adrian said, be younger, hipper, and cooler. And we have a new person on our team at UNAIDS who has collaborated with some people from Youth Lead and with some very creative musicians to come up with a U equals U song. So as we close, I just want to say thank you to all of you for coming. Thank you to our brilliant panelists, and let's commit to working together to spread the word and to make life better for people living with HIV and key populations throughout Asia Pacific. And I'm going to leave with a little snippet of our song.
We are the